Hello and welcome to another Royal Cyber webinar for creating awareness about robotic process automation. As the title suggests, this webinar is with the focus of automation in the healthcare sector. I am Asif Hussain and I have today with me Lisa Weber, who has exceptional expertise in the healthcare processes and is working as a functional architect at UiPath, which is a leading RPA tool available in the market. Royal Cyber has a phenomenal expertise in software solution development and system integration for many technologies, including RPA. We are an implementation partner with UiPath and many other RPA tools. So now let's see what is the agenda for today's webinar. In the beginning, we'll see some of the challenges the healthcare sector is facing today and how enterprise automation journey uh, generally is for organizations, specifically in the healthcare sector, and why to automate, why to focus on automations in healthcare. And in the end, Lisa Weber will take a deep dive into some use cases with a focus to for the improving clinical efficiencies using RPA. Her focus areas would be on use cases like how to automate end-to-end scheduling with clients, how to conduct hands-free check-in via facial recognition, conducting pregnancy test, pregnancy risk evaluation with AI Fabric in real time, using AI-based automation to make readmission predictions in real time, and some new ways to improve your clinical efficiencies and patient care. And in the end, we'll have um, a link for online assessment for RPA processes, how to jumpstart, and we'll take questions. So if during the discussion you have any question, you can type your questions in the questions section of this GoToWebinar, and we'll try reading them and answering them in the end. All right, so what are the challenges? Let's see. Healthcare is largely dependent on manual processes, as we know. Such a large number of manual processes slow down the overall efficiency, increasing the execution time and inefficiencies. So healthcare industry uh, is the largest employer in United States with over 18 million healthcare professionals. That is like 2.5 practicing health practitioner to 1,000 US citizens. By 2025, we might fall short by 100,000 physicians to ensure quality of care, failing which can lead to huge issues. United States has one of the highest costs of healthcare in the world. In 2018, the United States spent about 3.6 trillion on healthcare, of which averages about 11,000 per person, and that's before COVID. Healthcare back office is handling paper-based manual processes for a very long time now, which has held back its growth. Huge customer information is collected on papers and paper forms, which need to be entered in systems that increases manual work. The adoption of technology by healthcare providers in the early days has now left them with legacy systems, which do not integrate with new systems. RPA can integrate systems irrespective of their compatibility and making the information accessible between systems is possible now. The increasing use of documentation and technology in healthcare over the past few decades have made the process worse for the sector, mainly because documentation overheads, which results in less focus on patient care and treatments. Many of the forms physicians receive are in an electronic format, but physicians still either themselves perform some data entry or need staff to perform data entry for them. Patients still fill out forms when they come to the clinics. Physicians have to update multiple EMR to ensure continuity of patient care. The EMR doesn't even give them reminders to do things, forcing them to carry around a notepad or some sort of notes with to each patient. Physicians are almost always behind um, in their reporting need that is needed by the healthcare effectiveness data and information set, and the and to payers for value-based reimbursements. The delay is impacting their rating and revenue opportunities. Now let's see a typical automation journey for healthcare sector. There are several stages of an RPA program. The journey begins with standard use cases. You look for quick wins. The key drivers at this stage is generally operational efficiency and cost reduction. Then organizations pick value-added use cases. So you start looking beyond operational efficiency and cost savings and look for value-added use cases that extend beyond cost saving and can be delivered that can deliver previously unrecognized benefits. And then we move towards the processes that need intelligent automation, machine learning, natural language processing, OCRs, virtual assistants. So the aim is to improve customer and employee satisfaction in this kind of automation or this stage of automation journey. The goals of automation in healthcare can be operational efficiency, operational agility, reduce time and error, improving customer experience, including partner or employee satisfaction by reducing turnaround time and making the process more streamlined. And it can be things like ensuring regulatory compliance. Intelligent automation is a combination of robotic process automation and artificial intelligence. Technologies which together empower rapid end-to-end business process automation and accelerate digital transformation. So RPA is automation of steps performed by hands and hands of a human operator or human computer handler. And with AI brings head work. So that means learning and decision making can be part of it now. Enterprises today are moving towards hyperautomation. As this term is defined by Gartner, hyperautomation deals with the application of advanced technologies, including artificial intelligence and machine learning, to increasingly automate processes and augment humans. Hyperautomation extends across a range of tools that can be automated, but also refers to the sophistication of automation. That is like discover, analyze, design, automate, measure, monitor, or reassess. In simple terms, hyperautomation refers to a mixture of automation technologies that exist to augment and expand human capabilities. So automation will reach its full potential at the end of consistent process. We like to think of it as a journey, one in which a virtual workforce is deployed by the organization to help achieve its long-range corporate goals. Usually, it begins with simple, process-driven, highly repetitive manual processes that do not need decision-making at any stage, and move towards data-driven processes that need one or more decision during the process. The cost and complexity also increase when the automation move from doing to thinking and learning. Now let's see uh, automation in healthcare, how it is working. So first we'll see why RPA in healthcare and why now. So let's see why we need RPA in healthcare and why now. I think we all agree that administration in all healthcare organizations is striving to improve the experience. For example, our ability to automate the scheduling and registration process means less paperwork and a better experience for our patients and staff. So why not go for it now? Administrators are also working to enhance efficiency by managing intra-operability. An average practitioner has more than 3 EMR platforms and 2 EHR to work with. Automation can eliminate the need for manual extraction of data entry by administration to keep patient charts updated. Likewise, improving payment integrity is another area to focus. We can automate process across claims management and fraud, waste, abuse to improve cycle time and audit rates, which impact your overall payments and costs, cost per claim. We are seeing automation in healthcare domain in following directions. Heavy focus on finance and HR process automation due to the ease of implementation and ability to move quickly into production. Healthcare clients are using RPA to extract data from the health information management systems for pre-processing with their NLP, AI, OCR engines. Claims editing, medical claims, claim reviews, pricing validations, adjustments, and online regulation checks are growing and can be automated. And high volume automation of regression and UAT test scenarios that reduced post-production rework and cost. So this is another area where software solutions can be tested using RPA tools. We recommend customers to focus on process-based automations rather than task-based. So let's see. One area is value-based care. So like patient outcomes, reducing hospital readmissions, use of evidence-based medicine can be achieved or automated using RPA. Improving revenue and cost reduction is another focus, and reduction of administrative costs, improving the efficiency of productivity, efficiency and productivity, automating data exchange and processes, all can be covered by such area of automation. Intelligent outcomes, so we can create automations around detecting frauds, predicting analytics, and clinical decision support. Conversation AI is another area, like customer service administration can be enhanced using this, using automation in this area. Care coordination can be improved. Real-time patient records and education can be made better. Enhanced member and provider experience. So we can simplify the buying and enrollment process. We can digitally enable tools. We can control the quality of care delivered, and migration support can be delivered through automated tools. And telehealth is another area, like data extraction and readiness, post consultation messaging, voice transcription and aggregation, can all these areas can be automated using RPA tools. So RPA is the gateway for a whole new world of automation in healthcare sector. Many new avenues of artificially intelligent automations can open by RPA. Estimated 5.7 trillion is spent due to the gaps and limitations in the process. uh, inter interoperability between HIM platforms is a common driver of these gaps. Expenditure will increase by 30% in 2023. HIM access by physicians is still a barrier here, and RPA can help here. Patient experience in education. So channel management and conversation AI can lead solutions from status to adherence education. AI being used to determine care management and early warning indicators uh, is something that RPA can help with. Risk and compliance, rule mining, and machine learning is being used to audit and analyze 90 to 100% of records in many organizations. Intelligent documents intake. So 60% of common documents are still unstructured and require manual data entry, and that's where OCR and other techniques can help, and RPA can have it have the capability to take it forward. Now let's see some examples of specific benefits RPA can bring, or specific ideas for automation. Automation can drive better patient outcomes. For example, reduced high risk pregnancy identification and follow up from 4 weeks to 5 minutes. We can aggregate patient information in real time for an improved experience, build trust through more accurate and timely data, give patients the modern experience they demand, build patient confidence from registration to verification to check-in, improve physician and staff experience. So automations has created 15% productivity lift for primary care physicians. We can automate labor intensive workflows, reduce time spent in front of computer, and let the physician have more time with patients, create a streamlined experience, and automate administrative and repetitive tasks, reduce burnout and staff shortages by automation. Um, so to build a digitally transformed organization, we by mature from pockets of automation to a full program, including personal digital assistant. We can deploy automation quickly within weeks using RPA. We can enable process flows that are complex with multiple integrations, federal grade security to enable adherence to healthcare specific privacy regulations, reduce data inconsistencies across payer, provider, and patient. To talk further on some examples of specific benefits or use cases that RPA can automate, or um, how we can improve in the healthcare operations using RPA, some excellent use cases are picked up by Lisa. So we have renowned healthcare functional consultant and automation expert Lisa Weber with us. Hi, Lisa. Thank you, Vasif.
Hi, my name is Lisa Weber and I am part of UiPath's Healthcare Industry Solutions practice. My career path before joining UiPath focused on the administration of physician practices and hospital physician networks. Today I will be facilitating this webinar focused on how to improve clinical efficiencies through hyperautomation. The personas that will benefit from this webinar are the Chief Operating Officer and the Chief Medical Officer or Chief Medical Information Officer, and the Chief Nursing Officer. But we also have a bunch of new titles that started around 2015. These are the Chief Innovation Officer, the Chief Clinical Innovation Officer, and the Chief Digital Officer. The following videos we are going to show emphasize 4 key value drivers for improving clinical quality and effectiveness. These are removing the administrative burden on patients and employees, reducing the time it takes to diagnose patients, increasing the accuracy of treatment plans, and improving patient outcomes. For example, decreasing the length of stay or reducing readmission rates. For a copy of this webinar or the demonstration videos, please contact me at lisa.weber@uipath.com. Today we will take you through a patient's journey, starting with making a patient appointment through to the end of the initial clinical visit. The first 2 videos will demonstrate a patient making an appointment and then arriving at the clinic to check in and be seen by the clinician. The second 2 videos illustrate the use of machine learning algorithms and how their results can enhance the treatment and outcome of the visit. UiPath illustrates how machine learning modules can be embedded into the RPA platform using the AI fabric and can automate processes from beginning to end. Moving on to our first demonstration, let's watch a patient make an appointment effortlessly. Also take notice that an administrative staff person is freed up to tend to the patient's critical needs. One of the major functions supporting a clinic is scheduling. Many labor hours are spent scheduling, rescheduling, canceling, and bumping patient appointments. This is a mind-numbing exercise that happens all day, every day in a clinic. As technologies have improved, the ability for patients to schedule their own appointments is becoming mainstream. However, scheduling entails more than reserving a time with a clinician. It also includes the verification and validation of insurance information. In this video, a chatbot is used to guide the patient in scheduling an appointment, and OCR is used to extract information from the insurance card to provide real-time benefits information. All these actions are done without human intervention and recorded into the EMR using RPA. We also have reduced manual administrative time by 40% and increased the real-time verification benefits by 75%. Let's watch the patient secure an appointment. So the first thing we're going to see is the chatbot asking the new patient if they'd like to make an appointment and whether or not they're new or an existing. And since they're an existing patient, they're going to upload their driver's license. So they're providing their driver's license, and what this does, it gives the ability for the robot to open up the EMR and check to see if that patient does in fact exist. In this case, we use actually SolaceMed, which is an open EMR platform. There's many others out there, and we use a few of them in our demonstration so that you can see that it doesn't matter what EMR we use, but that RPA, specifically UiPath, can use any of them. So here we're entering into SolaceMed. We're searching for the patient. We're bringing up, her name is Gail Sample, and we're checking on her. We found. So with that information, we're passing it to the chatbot and saying, hey, Gail, is this you? Is this your date of birth? Is this information really you? And she verifies it. So now what we're doing is we're going back into the EMR and we're saying, okay, this is Gail. Now let's check her driver's license information and make sure that the address is the same. And in this case, it isn't. So we will update it according to what the driver's license says. So far, we've demonstrated the chatbot, the use of OCR and ICR to extract the digital information off of the driver's license, and then RPA as it navigates through the open EMR system. So now we're looking for the insurance card. Once again, the insurance card is going to be uploaded using ICR and OCR. We retrieve data from the insurance card, and we pass this insurance card to a clearinghouse to understand whether or not Gail does in fact have insurance or not, and what type of insurance. Once we've gotten all the information and we're confident with what Gail has provided us, we can go ahead and make the appointment. As you can see, right now we're doing everything. We're adding the new health insurance plan to the EMR. Now, typically this is done by someone on the phone or someone that's at the clinic wanting to make a follow-up appointment, and all of this stuff is done. And as you can see, there's a lot of steps, there's a lot of process, it takes a lot of time. We've slowed this video down to be able to present it, but you can see all the activity that we're freeing up at this point. Not to mention that Gail is sitting at home using her computer or her phone to make this appointment. And there we go. We're now picking an appointment for Gail's sample. And if she approves it, she will be all set. We've scheduled the patient's appointment, so let's imagine the date is here and the patient has arrived in the clinic. Another repetitive rules-based task performed by the front desk is patient check-in. This is done for every patient, even if they don't show up. Another challenge is the protection of your personal identity when checking in. Using a camera with facial recognition software, a patient's identity can be verified and the patient can be checked in anonymously. The facial image triggers a task in Orchestrator to be started. This task is the bot navigating through the EMR to check in the patient. Once a patient is checked in, the medical assistants are notified of their arrival. All this can be done while the front desk attends to patients who need further assistance. This simple process has many benefits. Manual check-ins and errors are reduced by 75%, insurance fraud is minimized, and HIPAA compliance is increased to the highest standard. Let's see how we can check in a patient quickly and easily. As the patient arrives, the camera snaps a pic. In this scenario, we are using OpenCV as the facial recognition software. A task is created within Orchestrator. At this point, an unattended robot is triggered to start the check-in process. And as I mentioned before, in this example, we use Open MRS, showcasing our ability to use any EMR system. We open the system, we look for the patient. In this case, it's William Nelson, and we look up the patient history. So the rest of the video shows the bot navigating through the EMR and executing the actions needed to check in the patient and mark them as arrived and alerting the medical assistant that the patient is ready. The next steps you will see is the robot synthesizing all the medical documentation into the pertinent elements the clinician wants to review and needs to know upon entering the exam room, as we see right here. The intent is to have this displayed in a format that requires no screen interaction and is easily digestible by the clinician. So the first two videos had a lot to do with removing administrative barriers and streamlining patient access processes. Now let's look at a couple of videos focused on improving patient outcomes using state-of-the-art algorithms. Let's imagine now that a patient has just discovered she is pregnant for the first time. Today's problem around identifying women with high-risk pregnancies is that the process is very lengthy and involves the coordination and approval process between payers, hospitals, and case managers, which is difficult. The video illustrates how the average time frame of 4 to 5 weeks can be reduced to minutes by incorporating RPA, document understanding, and machine learning algorithms. The AI fabric is a platform that embeds and executes RPA, document understanding, and pre-built algorithms. The quantitative benefits are 95% reduction in enrollment cycle time and a 65% increase in patient compliance with high-risk protocols. The qualitative benefits are that the patients and case managers are paired early on, and therefore the patient becomes more engaged and compliant with their high-risk protocols. In the end, there are healthier babies. So let's watch this in action. We got this video as a courtesy of Amatec. The first slide, you will see all the processes they described that they automated and able to reduce the enrollment time for a high-risk pregnancy from 4 weeks to an hour and to decrease. And if you look at that across 10,000 patients annually, that reduces care costs by approximately $11 million. The process is using an unattended bot to navigate to a folder containing pregnancy risk forms and extracting the information from that folder. The right-hand side of the screen is the actual form, and the left-hand side illustrates how accurately the data was extracted. It is within this left-hand screen that corrections to errors can be made. Once everything looks good, we do a couple more checks, and then we take the information and run it through the machine learning model. We check the member eligibility, we check the provider information, and then here we go, analytics at work. It's hard to see, but this first-time mom has a high-risk score. At this point, the new mom is assigned a case manager and information is sent to her insurance carrier. Right now, they're assigning the case manager. Everybody gets notification, and now both the patient and the case manager are aware that there's a high-risk pregnancy. So the second demonstration uses a machine learning algorithm built by Data Robot to predict a patient's propensity for being readmitted once they are discharged from the ER or hospital setting. But we're going to do this in real time. As you're there in the ER or as you're there in the hospital being admitted or being discharged, we'll be able to predict what your readmission rate is. So healthcare is focusing time and effort towards reducing readmissions to decrease costs and improve care. This is one of their significant initiatives at this time. Currently, a patient enters the ER and is seen by a physician who is not their primary care. The ER physician has limited time with the patient, and his or her focus is on treating the emergent problem and then discharging the patient to move on to the next one. Because the patient's entire history is not reviewed or taken into consideration, often the patient will end up back in the ER or readmitted. The solution includes using RPA to navigate through the electronic medical record and aggregate the patient's health data points that will be compared to Data Robot's machine learning algorithm. Results of the comparison give an indication of how susceptible the patient is to being readmitted. Based on this real-time information, a treatment decision can be made that will benefit the patient. They can be given a protocol based on the results. Measurable outcomes include a 40% reduction in readmission rates and a 60% improvement in patient outcomes. So let's watch this. As the patient is sitting in the ER, Unattended Robot has kicked off to search through the patient's medical record and find critical data points that are needed to run through the machine learning engine. Once all the information is gathered, it is formatted and submitted into the ML engine. Here we see reviewing the history and going through each tab to extract information. We're now gathering all this information and formatting it in such a way to feed it through the ML engine. Oh, there it is. The patient has a very high probability of being readmitted. So the protocol in this case is to schedule them for a follow-up appointment within 1 week. You don't need anybody to do this except the robot. So they're assigning another care manager to this patient and getting them in with their primary care physician within 1 week. The message is also sent to the provider that one of their patients was seen in the ER over the weekend. I hope you've enjoyed today's webinar, and we provided you with many ideas and thoughts on how to lessen the administrative burdens and improve clinical efficiencies using automation, chatbots, optical character recognition, facial recognition, and artificial intelligence, such as machine learning algorithms. Please be sure to watch our other webinars addressing the intelligent back office and solving interoperability to improve care coordination. Thank you.
Thanks, Lisa, for this very informative demonstration of the automation use cases. Now, before we conclude today's webinar, I would like to tell the participants that Royal Cyber has a free, automatic, and online RPA process assessment feature on the website. This asks for a few questions and can assess your process within seconds to let you know how feasible a process is for automation and what is the estimated effort of building this automation compared to the assessed benefit in terms of money or human time spent on this process manually. So you can write down this link or go to royalcyber.com, and in the RPA services section, you can see this link, a banner for it. So here's what we from Royal Cyber offer as a jumpstart package to let our customers start small and see the power and ROI of RPA based automations in just a few weeks. This kind of jumpstart often helps convincing higher management to go for a full-blown automation program. What we do is we pick a single process of automation with the help of our customer and develop an RPA automation for it. These are the three phases of such a jump start. We can show the potential of RPA and Royal Cyber uh, as well, uh, with the help to help the customer see internally what they may need to have in their organization to create their own center of excellence for RPA or drive an RPA program within their organization. Today, for the participants of this webinar, we are offering 30% discount in the form of 2 weeks of complimentary services out of 6 weeks of Jumpstart package. Or you can contact us for a specific POC to deliver. And you can contact marketing here in the question section, or preferably by email at this address. That's all from my side. You can type your questions in the questions section and we'll try to answer them. So we'll wait for a few minutes to see what questions we have, and we'll start answering one by one. All right, so first question I have is, how do you generally ensure your RPA programs won't break when automating over changing landscapes, such as documentation template changes, web page, application UI updates, database change, in all situations where the automation is no longer available in the same location as before? Yeah, so it's a challenge that is generally being asked about, and like a lot of customers are worried about it, and it's a real issue. Anything you are automating, any software or any screen, any part of the process, if it changes, like a version upgrade of the underlying software through which the process runs, it is highly likely that the automation through RPA will break, if because it is using UI to interact with the applications. Um, so first and foremost, we emphasize that try to focus on the processes that are less likely to change in next few months or next few years. Um, that's one of the criteria of selection of a process for automation. Apart from that, yeah, there will still be changes in the underlying softwares, and there still will, like, probably you will go for some applications that are likely to change over time. So in that case, there it's more of an administrative thing. What we recommend is, whenever, like throughout the company's change management program, keep a check that this particular bot or this particular automation relies on these applications or these application screens. whenever a change is suggested to uh, do check against that list, that what bots will be impacted by that. And of course, whenever you have a change in any application, it goes to your staging or your UAT, your test environment. That should parallelly be available for your bots, and there you can test what change will impact the bot as well, and the 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 RPA team or the automation team can be prepared about any change that is going in production, and work to resolve for it. All right, I hope I answered your question. Second, how do you generally trigger and deploy RPA programs? For example, do you use local machines, virtual machines, just in time triggering, or as needed, or batch run, for example? Um, your question pretty much covers all the approaches, and there is no best way of doing it. That, like, how you want to have a certain automation implemented or the overall program implemented depends upon your needs, for like your priorities for the organization, as well as the nature of the process that you are going to automate. So for example, if there is a process that interacts with the applications only available uh, to be accessed within your own infrastructure, like within your own office or through a VPN, then you'll have to deploy the bots also within that environment so that they can talk with those applications or open those applications and work through them. Whereas if uh, and part of your question is about like whether you will keep these bots attended or unattended. That's the term we use here. And that also depends, like if a process is something that will help a human user somewhere in the middle of his usual operations that he or she does, then we will probably put it attended, so that where and when needed, a human user can trigger that and get the results. While if a process is something that is part of a bigger process that is totally automated already, or does not need is not dependent upon a human intervention anywhere, so you can probably would go for an unattended automation placed somewhere in the cloud or on a VM, and that will be triggered based on time or based on some other trigger, maybe an email, a database change, a file change or file placement. Anything can trigger that. um, Triggering or as needed or batch run, for examples. Yeah, so batch runs, yeah, it is kind of similar, but I think I answered what you were trying to ask. If you need any further clarification, you can ask here or you can email me, asif.hussain, asif.hussain at royalcyber.com, or at info@royalcyber.com, the address you're seeing on your or marketing address you're seeing on the screen. Even on that you can send it. uh, I have another question: how scaling up is handled, and how is it the price impact of it? So that's one of the strong points of RPA. Like if you have operations where the process needs to be like the load decreases or increases because of seasonal sales or something, uh, we can put extra bots, and we can remove them later. We can automate this even, and have more cases processed on a certain time, and then reduce the cost again by decommissioning them. Uh, Another question is AI ML features we saw in the demo. Are they part of UiPath? We saw different demos. Some of the AI ML features are part of the UiPath and other RPA softwares have similar features. Specifically, we saw a readmission process demo. It was using data robot, so we have the flexibility of using external tools, including AI/ML tools, to get decisions on. So to certain extent, yes, some AI/ML features are within RPA tools and some are not, and for that we can depend on external tools. All right, so that's it. If any of you have any further questions, you can contact through email. Uh, with this, I would like to ask for permission to close this session. Thank you very much for attending today's session. It was part of RPA awareness program. Please stay in touch or visit royalcyber.com to know about upcoming sessions and webinars. Thank you very much. Take care. Bye.